diabetes related Kate,
Yeah. Are you
are
going
you hearing that?
What is it?
It must just be my phone. It's saying this meeting is now being recorded. I don't,
Yeah,
my phone just,
it just alerted you because you're on the phone. No
okay.
worries.
So the next slide, the assessment of comorbidities. Besides assessing the diabetes related complications, you want to be aware of, yes.
Yeah, I have a question regarding this hepatitis B vaccination. I mean, I know it started like 2-3 years ago. They mentioned regarding the hepatitis B vaccine, and then I didn't hear from anywhere any emphasis on the hepatitis B vaccination. And one of the things I fall short on that in catching up with my patient because they have to come repeatedly. Now, in your practice or in your opinion, how strong is this hepatitis B vaccination recommendation and how much we should follow about it?
Yeah,
is it just for insulin?
I think is, you know, my personal opinion, vaccinations are one of the first lines and one of the most important lines of defense that we can give these patients. So I try to push for this. So if you go back to the previous slide, Kate, the one that starts with provide routinely recommended vaccinations. So at the bottom is the hepatitis B recommendation. So the 3-dose series for unvaccinated adults with diabetes, age 19 through 59, and then consider the 3-dose series of Hep B to unvaccinated adults with diabetes that are greater than 60. So I certainly think that this is one of the most important things that we can do for them is try to prevent the epidemic of these things spreading. And I push it. I really do. And then there's the CDC website is phenomenal. If you guys have more questions about any vaccines with diabetes, I strongly encourage you to check it out. The zoster, the flu vaccine, pneumococcal, Tdap, you can click on the links on the bottom of that CDC website for patients who have diabetes, and they'll explain the timeline and the chronology of all of this and when to give them for each vaccine. So going back to the assessment of, did that answer your question?
Yes, thank you.
Sure. The assessment of comorbidities. So besides assessing the diabetes-related complications, you want to be aware of common comorbidities that affect people with diabetes and can complicate our management. Going on to the next slide, Kate. So autoimmune diseases. So, your type 1 diabetic patients have an autoimmune disease. They have antibodies that attack their pancreas and prevent insulin secretion. And so once you have one autoimmune condition, you are at risk for many other autoimmune conditions because autoimmune conditions run in clusters. So the recommendation is to consider screening all patients with type 1 for autoimmune thyroid disease and celiac disease soon after their diagnosis. And then the thyroid is recommended to be screened yearly thereafter. And then I do celiac screening thereafter only on a case-finding basis. Next slide, cognitive impairment and dementia. In people with a history of cognitive impairment and dementia, treatment should be tailored to avoid significant hypoglycemia, which can worsen their dementia and their cognitive impairment at baseline. So I really, when I see a patient from a nursing home or a sick patient from the hospital, I really try to assess what their resources are at home for them to give their medication, because overdoses happen very commonly with insulin, sulfonylureas. Those are two of the most dangerous in my opinion. And I try to use oral medications as much as possible unless I know the patient's a type 1 or they're insulin dependent type 2 and it's a necessary drug. but you always want to make sure that they're able to give it to themselves, you know, and not developing maybe peripheral neuropathy of the lower and upper extremities too, kind of making it more difficult to give insulin or to give their medicines as well. So just being mindful of, you know, cognitive impairments and dementia with the drugs we use. Moving on to the next slide. So conditions that are more common in patients that have diabetes. So we know, you know, obesity leads to many things, but patients that have diabetes more often have fatty liver disease, so elevated enzymes, fatty liver on imaging, hepatocellular carcinoma, hip fractures, low testosterone in men, obstructive sleep apnea, and periodontal disease. Next slide. So cancer. Diabetes is associated with an increase of risk of cancers of the liver, pancreas, endometrium, colon, rectum, breast, bladder. The association, they think, could result from shared risk factors that patients who have type 2 diabetes and cancer, such as older age, obesity, and physical inactivity. But there may also be some underlying diabetes-related things that we haven't discovered yet about diabetes physiology itself, or even some of the diabetes therapies that we use. You know, think about the GLP-1 agonists. They have a warning about medullary thyroid cancer. And so when you start that in a patient, making sure that you feel their neck and making sure they don't have thyroid nodules, or they don't have a family history of thyroid cancer, or they don't have nodules on their most recent ultrasound if they've had a thyroid ultrasound in the past. So who knows if some of the treatments that we're using right now, especially all the new drugs that have come out, maybe those drugs themselves have some role in these patients developing these increased risk of cancers. So patients with diabetes should be encouraged to undergo, this is the next slide, Dave. Patients with diabetes.
I'm sorry. We're gonna have to stop and call the session just because it's at time, but I'll make sure we pick up right here. Are there any final questions? I'm so sorry to do that, Jennifer. I hate that.
No, that's fine. I have a patient at one, so
Okay,
thank you.
well, good. I'm glad I'm keeping everybody on schedule. If there are any questions, please let me know. I will be sending out these slides that we've gone over. And Jennifer Boyd, thank you so much for doing the case. I appreciate it because I was creating a mock case as you sent it in. I was like, I do not want to do that.
Oh, no, it was a great session today. Great help and great didactic. Thank you guys so much.
Awesome.
Really
Everybody,
helpful.
Thank you. Thank you for
Everybody have
presenting.
a
I know that